everyone. Thank you so much for joining us. I see that everyone is coming in now, so we will just wait a moment as people can filter in and join the call before we get started. But thank you again for joining us. We're really excited to be here with our Young Alumni Changemaker Award recipient, Haruka Kokaze from the class of 2018, and her mentor, Dr. Kathy Pike, who's also the parent of 4 Mustangs. So we are very excited to have them here today and to hear them talk. As everyone gets logged in and gets settled in, I'll just give a little bit of a welcome from the alumni office. You probably have all heard of me by now. I'm Miranda Liu, the alumni coordinator, and it's a pleasure to be the alumni coordinator for you all. Alumni Connect is a program that we started during COVID to sort of bring people together around the world when we couldn't leave our houses, and Zoom was the only way that we could get together. So that was great for, during the time when we were all locked down. And then as things started to open up again, the program has evolved in a variety of different ways to help bring alums together around the world. So we have some local Alumni Connect meetups now. We have Alumni Connect in-person networking events. And then we also have webinars like these still that we love to provide live for alums who are in many time zones around the world. So thank you all for joining us. And today with us, we also have our alumni moderator, Deanna Elstrom. Deanna is an alum from the class of 86, and we are thrilled to have her here. She's also our Alumni Council president. So I will hand it over to Deanna. If you have any questions or anything that you'd like to ask the panelists, please don't hesitate to put it in the Q&A. We will be moderating the Q&A over the course of the call, and we'll take a question time at the end. So we'd love to hear from you. Don't hesitate to put that in there. And now I will hand it over to Deanna.
Thank you, Miranda. Thank you, everyone, for tuning in and coming to listen. I think it's going to be a really fascinating conversation. And thank you to Dr. Pike and to Haruka for joining us and having this conversation with us today. So I want to just jump right in. We're going to be talking about mental health, and we're going to be talking specifically about transnational mental health, which I'm sure is a topic of interest to the whole ASIJ community. But first, could I ask Dr. Pike and Haruka to introduce themselves briefly? Tell us, a little bit about what you're doing now professionally, how you came along your journey to focus on mental health, and also what's your ASIJ connection? And we heard a little bit, but if you could tell us a little bit more about that. Dr. Pike, can we start with you?
Sure. Thanks so much. It's really a delight to be here and to join this conversation today. I got to Japan with my family in 1998, and we stayed through 2010. And 4 of my children and my niece went to ASIJ. So we are a true Mustang family. And 3 of the 5 kids graduated from ASIJ. My son Brendan, my niece Jessica in 2007, and my son David in 2010. And then I have twins, Julia and Benjamin, who got to start at the beginning with the NK and moved to the ELC in its inaugural year, and then on out to Chofu and stayed through the middle of middle school and then headed back to the US. During the time that we were in Japan, I served on the board of ASIJ for a number of years, was involved with a number of different initiatives, including the search for head of school following Tim Carr. And my work while we were in Japan, I'm a clinical psychologist by training, and went to Japan with a research grant and a Fulbright Research Award to understand further the risk factors associated with eating disorders from a cultural perspective. We were conducting a similar study in multiple different sites in different parts of the world and understand what is the role of culture, how does risk for eating disorders vary by culture, and was a visiting faculty member at Keio University and a ultimately served as the associate dean for research at Temple University in Japan before heading back to the US and to Columbia University, where I'm on faculty. So
Wow.
we'll jump into more conversation, but a bit about me.
Thank you. I was saying before, as we were preparing for this, I look at your resume and just feel like, what have I done with my life? You've done so many things. It's so impressive. So one thing that's really interesting is you've had 4 kids who have gone through ASIJ kind of at different times to some extent and different parts of their life. You've been on the board. And then your kids have gone on to other schools, or they had other schools. What do you think really set ASIJ apart, or what for those 4 kids was the common thread that kind of they took from it into the rest of their lives? It's kind of a hard question, but
big picture, I would say that ASIJ, during the time that we were there, nearly 12 years, was a community that lived its values and built connections that have lasted a lifetime for each of us. So I'm looking at the list of attendees and I see friends and teachers' names and people I knew who were contemporaries of mine as parents, individuals who were teachers to my kids. And this is a community, ASIJ is a community that I keep saying it's the community that keeps on giving. And, in fact, that's the story that Haruka and I have to share. The community connections over and over and over again. And I want to turn it over to Haruka, but to further underscore that point of connection, next week I'm traveling to Europe and I will see an ASIJ friend in London, and then I go to Copenhagen and an ASIJ friend in Copenhagen. An ASIJ friend is coming with me. So, it just is a community where the experience of real connection runs so deep that for us, it has lasted a lifetime.
Wonderful.
Or is lasting a lifetime.
Thank you so much. Okay, Haruka, how about you?
Thank you so much, Tiana. And thank you so much to Miranda and ASIJ for having me on this panel with Dr. Pike. So I'm Haruka. I'm currently a graduate student at NYU studying counseling for mental health and wellness. I'm also a substance counselor intern at Weill Cornell Medicine, a hospital here in New York. So I provide both individual and group psychotherapy to clients with substance use disorder. I also do a couple social justice related internships and research assistants position, but I think the most relevant one here is the research assistant position that I have under Dr. Pike, and we got to explore the eating disorder from global lens since 2 summers ago to now, and we are kind of transitioning into workplace mental health. So I'm really excited to continue my research academia journey with Dr. Pike. Just a quick background, it's very similar to a lot of the ASIJ kids. I was born in Kobe, Hyogo Prefecture, and I was in Japan. I got to New York because of my father's job, and then so I was there for elementary and middle school. And then when I came back to Japan, I came to ASIJ. I came here for freshman year. I thought I was going to finish up the high school, but again, just like an ASIJ typical story, my father got relocated again. So we moved to Houston, Texas, and I ended up going to a very small Scottish Episcopal school, which was a very different culture from ASIJ, but I loved it. So that's kind of my connection to ASIJ, and I, study mental health, and that's kind of the perks of having such a diverse background, just like other ASIJ students, of being able to meet so many different people from different places. And I often consider that I lived in more than 2 countries because people consider Texas their own country. So that's another nation there. But because I was able to witness how, different people express emotions very differently, I was very invested in emotional development. So actually, when I first came to NYU, I came as a early childhood and special education. I wanted to become a teacher. But after that initial exposure to schools and school setting, I realized it's not really for me, but I was still very much interested in emotion. And then I took a gap year, and maybe I can little expand on that later. But that's kind of when I had this eureka moment of, oh, this is what I want to do, and this is where I want to be. And then that's how I kind of kept going into the clinical and counseling world. And here I am today, being able to do some research work with Dr. Pike.
Great. Thank you so much. Actually, yeah, can you tell us more about your gap year? I guess I'm interested in understanding what was the kind of impetus for mental health. So you talked about how you started at NYU in early childhood development, and then said, okay, I'm really interested more in the emotional side of development. Can you tell us a little bit how your interest became more focused in the mental health direction? And I think that happened during your gap year, right? So
yes, during my gap year, a little after gap year too. So during my gap year, I actually went back to Texas because that's where my parents were at that time. And then I was able to do like a full-time volunteer work at 3 different hospitals in Texas Medical Center. So I was at the MD Anderson Cancer Center, Memorial Hermann Hospital, which are both known for their oncology department. So I was able to do a lot of work under oncology social workers. And so I did a lot of emotional support. I did a lot of resources support, connecting people to chaplain, connecting people to their transportation needs, and all that kind of things. And when I was there, it's really interesting because when I first went to Texas, I remember my ASIJ friends were like, how are you gonna survive there? You know, are you gonna be on the horse to school? Like that was kind of my image going to Texas, but it was one of the most diverse cities that I've witnessed so far. So a lot of people actually came all over the world to MD Anderson and Memorial Hermann. So a lot of my patients were very global. So because of that, you know, I was able to witness how the mainstream mental health practices and resources that the clinicians are trained to use don't really work for people who are not from the mainstream and the majority groups. And so that was kind of the eureka moment of thinking how, wow, you know, these things are out here in the field and we all use these, but they don't really work for people from, you know, Japanese culture or Japanese Americans or, you know, Japanese expats who came from Japan to Texas. And so that was kind of moment that I realized that I want to use my unique background to apply to what we have today and then tailor and make what we use today in a clinic or in hospital accessible and appropriate to people from diverse background.
thank you. So this segues us to this idea of transnational mental health. So can you, to be honest, before we were preparing for this, I had never heard that term before, or multicultural mental health. And I think that's what you touched on just now. So can you tell us a little bit more about what is this? What does that mean? And you know, what you noticed during your time at these medical institutions in Texas as not being necessarily well suited to Japanese Americans or Japanese American patients, some of your experiences with that. And is this a field that is already existing, or is this an emergent field? If you could just kind of talk about that aspect.
Yeah, of course. I'm sure Dr. Pike has more extensive knowledge on this than I am, but what I'm observing is that transnational mental health or multicultural mental health kind of refers to this holistic and cultural sensitive approach that we go into when we provide care. And so it really acknowledges and respects the, you know, diverse backgrounds, experiences, and cultural nuances the individual bring in their everyday life. So for example, I remember when I was providing a care to this Japanese elderly person, you know, he came in thinking that he was struggling a lot with depression and other mental health issues. When he came to non-Japanese speaking or person who didn't, grow up in Japan and US, he actually got sent to the ER. And what happened was that he was saying how, he's about to die and he thinks that, someone's gonna come, get him to heaven and all this kind of ideas about death in a very vivid manners. But for me, when I heard this story, I thought about that's like my grandma and that's like my grandpa. In a lot of the Japanese culture, as you age, it's very, normal to see elders and older generation talk about death in a very casual manner. I remember every time I go to US, my grandma would say something along the line of, "Oh, I probably won't see you again." It's like, "Oh, grandma, don't say that." This is kind of a very casual conversation. But in America, that vivid conversation kind of, it is a very high alert state. And as clinicians, all of us are trained to report. It's a mandated report that we have to make, send them to ER or call 911. And that's the regulation we have. But for me, that was not a suicidal ideation or any of that emergency alert to me because I knew the culture, I knew the nuances. And so for me, that was one big example of thinking how, if we, really follow all these regulations that we use in America, how many people have to, experience maybe a secondhand traumatic experience of, this, Japanese guy got sent to the ER, can't speak English well, and he's like, I'm not really sure why I'm here. And he was very scared. And so for me, I wish I was there in initial intake so that I was able to really put in, this conversation seems to be very normal in our culture, but let me take a look further just to make sure, not to immediately, panic and, send them to ER. So I think a lot of these examples do exist, but they don't really come into our case studies or textbooks. And that's why cultural competent education is so important. And that's something that I get to have a lot from NYU. But again, it's not the traditional route. And so when I start realizing this and having this kind of conversation with, my colleagues, that's kind of when I noticed that this is very important as we are becoming more diverse and people have different backgrounds and need those nuanced holistic care. I think I will be able to really leverage my background and then apply it to the field. So that was kind of one significant moment that really made me committed to the field that I'm in.
So interesting. So this elderly patient came in and he was depressed. He was just talking about his death in general, but the protocol is that they had to send him to ER because it sounded like maybe he was a suicide risk. They misunderstood what he was saying. Is that what happened? Yeah.
I think that was the observation that I made.
Wow. So interesting. So thank you. So Dr. Pike, is this area of transnational mental health, is this something that is kind of people are becoming very well versed on, or is it still very emergent? And is it starting to impact training of medical care providers in the US or internationally, or is it still just something that's more academic than actually being put in practice?
It's not just academic, but it is still emerging, I would say, because to Haruka's point, there's growing awareness. First of all, there are the populations, the individuals seeking treatment for mental health issues is becoming much more diverse. So there are many, many different communities that 10 years ago or 25 years ago would not access mental health services. So the field was made up of a community of providers who looked like the people who were seeking treatment 20 years ago or 25 years ago, but that's not the same group anymore. And so there's a growing awareness really across the country in the US and across the globe around the need for health providers broadly, not just mental health providers, but mental health providers for all kinds of health conditions to increase the extent to which the providers of care look like the people who are seeking care and represent communities, the diverse communities of populations. So there's a broad and widespread understanding about the importance of that, a lot for the reasons that Haruka highlighted in her case example. I think it's really important it's a very simple statement, but it's a statement that has many layers to it, because we need, and it's a commitment that needs to happen over time, because building a workforce that includes many different kinds of individuals with many different kinds of backgrounds takes time, right? And so we need to be committed to that. And then I think we also need to be very careful about understanding the meaning of color, where it's at play. And for example, here, the example that Haruka made about how not understanding culture can lead to increased referral or inappropriate referral for care. It can also, there are ways in which not understanding culture can lead to a failure to refer for care or to provide care. A clinician might say, oh, well, that must just be a cultural thing, when actually it's not at all a cultural thing. They're suicidal, right? So you need to know and be experienced, because there's a big risk of making the wrong attribution. And if you don't understand where a person comes from. And I would say the further nuance is that you, at each juncture, you need to ask about the relevance of an evidence-based protocol, and does this apply here? Because in fact, certain evidence-based treatments, it doesn't matter if you are male or female, or if you are Japanese, Chinese, Korean, or English, or French, but sometimes it really does matter. So knowing what is, it's sort of like, right, with writers, when you learn how to write, there are certain rules, and then once you know the rules, you're allowed to break them. So you need to know the evidence-based treatments so that you know how to apply them. And applying them requires the wisdom that Haruka is describing, of really knowing how to bring culture into that decision-making tree to know where and how to adapt evidence-based treatments with a knowledge of culture. So it's emerging. And I think it's really important that we also need to not swing too far, because there are shared experiences. So I think it's really important for people to think about in this idea of match, there might be somebody, for example, for whom it's part of the ASIJ community, being a third culture kid. It might be more relevant to somebody who's an ASIJ alum who wants to seek treatment. Maybe they have Japanese lineage, or maybe they have lineage from someplace else. But what might be really important culturally is that they have a therapist who understands third culture kids, right? So think about, how do you define culture, and how does it then come to play?
Right. And yeah, exactly. When culture comes into play and when it doesn't, when you don't want to just define things by, oh, they're from this person, they're also individuals. So yeah, combining that aspect of it. Thank you. And you talked about evidence-based protocol. Can you tell us exactly what that means? Sorry, for those of us who are less Well versed.
The field of therapy and the field of clinical intervention for mental health conditions has evolved a lot. And there is a long history now, decades of research to document what treatments work in what conditions. And so, and a medication that works for anxiety in one community is likely to work biologically similarly in other groups of various ethnic backgrounds, but you need to be sure that that's the case, right? That there's not a particular cultural distinction. Same thing for psychotherapies. The evidence-based psychotherapies need to be delivered in a culturally competent way. So the core principles of how a psychotherapy works and what are the core principles to help someone with depression or eating disorder or anxiety or some other trauma-related mental health concern, the core principles are going to remain core principles. But how you do that work may vary depending on the clinical context. So a concrete example for in the world of eating disorders, family-based therapy. There's a evidence-based protocol for family-based treatment for young adolescents who have eating disorders that engages family members. A piece of the protocol includes assertiveness training for the individual who has the eating disorder and role playing around how to assert oneself with one's parents. The cultural norm of what would be appropriate is very different in different contexts. So the idea that you need to help an individual who has an eating disorder find his or her voice, express themselves effectively, learn how to assert themselves constructively, that principle holds true. But how you might do that in a traditional Japanese family versus a traditional French family or a traditional Israeli family needs to be culturally understood.
Right. That is super interesting. Thank you. And just segueing to how you guys connected. Haruka, can you tell us a little bit about how that connection happened and how you've been working together?
Yes. So it's really, truly been such an honor and privilege to work with Dr. Pike because I don't think she knows how much I was a fan. I still am a fan of her work for a long time before I actually had the courage to, reach out. So I've known about Dr. Pike for, I think, a couple of years before I actually met her on Zoom. It was during pandemic. So because I had this internship at this nonprofit called US Japan Council, a lot of the people actually are, I usually call USJC kind of extension of ASIJ because everyone I meet are either parents of an ASIJ alum or ASIJ alum or people who know who went to ASIJ. So it's a very comfortable community. And so I was able to network a lot of people there. And so everyone kind of knew that Haruka mental health, Haruka anything mental health. And so when I had a conversation with the CEO, Suzanne Basala, she said, well, have you talked to Dr. Pike? And I said, well, I read her, peer-reviewed journals. I watched her TED Talk, but did you happen to know her? And she's like, yeah, let me connect you. And so I had this wonderful introduction and we got to meet on Zoom. And little did we know, her kids went to ASIJ, I went to ASIJ. Her kids and I also went to the same elementary school in Scarsdale. And there was just such a, a human connection that's beyond the field that we are both in. And so right after that, I found out that she, founded and directed this program at Columbia called Columbia WHO Global Mental Health Program. And they were looking for the rising seniors to come to apply for the summer internship. And fortunately, I was a rising senior at that point. So I applied for it. I fortunately got the internship. So there I got to really work with her and her colleagues every day for a couple months over the summer on diverse global mental health topics. So my topic was on eating disorders, and other people had, HIV and other topics that is very much prevalent in and outside of United States. So that's kind of how I got connected to Dr. Pike, and I credit ASIJ a lot for that because, in my introduction, I really did emphasize that, hey, we have this ASIJ connection, you should really hire me for this internship. So, that's the emphasis I had. So thank you, ASIJ, for that.
So Dr. Pike, besides the ASIJ connection, what stood out to you about Haruka when she introduced herself?
Well, Haruka is a star, and so the affection and admiration goes both ways. And and actually, the ASIJ connection is a real one, and everyone should use it. I have to tell you, my son David, who graduated in 2010, he has this strategy of traveling. He always travels with his ASIJ sports bag, the black bag with the gold cords, yep. Because no matter where we go in the airport, somebody will stop us and say, "Hey, did you go to ASIJ?" So that's always, that bag travels with us. So the ASIJ connection is real. But also Haruka stood out because in reaching out to me, she was very clear about her background and her interests, and articulate about how she wanted to grow and learn and what she could contribute. And in reading her email, I smiled because I thought, she's really she's an ASIJ student, and she's got there's an opportunity, I think, and an experience developmentally that comes from being part of the ASIJ community of learning how to engage globally and feel comfortable with many different people and different audiences, and thinking carefully about how can I connect to this person and what's that story. And it was quite evident that you were really adept at that, Haruka.
I love that phrase, how to engage globally, because that is something. I have a son who's a senior now, and I always think, what is it that he's able to talk to everyone? And maybe that's it. You're dealing with different cultures. You're always able to find some point of commonality with people from all over. That's wonderful. And so how have you what are you working on together now, Haruka? Can you tell us a little bit? I think you said that you're interning right now, right? And so what is that like, and what's the term of that, and what are you guys working on?
Yeah, so I think we are kind of in a transition phase, because the project that we've been working on for the past 1.5 years was on eating disorders from the global lens. And we're so excited that, our peer-reviewed manuscript got accepted into our publication. So that just happened maybe, a month ago. It was very recent. So now we are kind of the mindset, okay, that project is done. It's been, in a good hand for now. So what can we do next? Because when I first came to Dr. Pike, I actually came for her work for workplace mental health. But that time, the summer internship didn't have that category during that year. So, but I was so eager to learn from Dr. Pike in any shape or form. And because I have had the experience of struggling with the eating disorder myself, I thought I would love to explore this field as well. And Dr. Pike was already an expert of that. So that was already a perfect match. But part of me was always that I want to do the workplace mental health work with her. And so, right now, with Dr. Pike transitioning into this one mind, that's another huge opportunity for me to explore in a more higher level platform. And again, at the US Japan Council, I was able to network with a lot of people from Japanese corporates. They're usually the people who head Japanese subsidiaries in America, because my interest lies in Japanese expats and their families' mental health. And people say research is me search, which is kind of true, because as a child and an expat, I'm very curious to why am I like this, so I was able to really network within that council. And so I kind of got the hands into the Japanese subsidiaries, Japanese expats' mental health. And because Dr. Pike's work is very much global, she targets, everyone. I really wanted to, contribute from a very specific yet very important personal connection to both of us, but very important for Japanese, economy, in terms of how can we better the workplace mental health for Japanese expats here in subsidiaries and also back to the headquarters in Japan. So that's kind of where we are in terms of how can I bring what I have had so far through my study, but also the network that I was able to do thanks to, I guess, the ASIJ communication skills, being able to network with people from diverse backgrounds. How can I apply it to the higher level? And I think Dr. Pike is kind enough to provide this platform where I can now apply things, because I've been accumulating knowledge and studies. I would love to go to the next step. Where can I do that? And Dr. Pike said, well, let me help you. And so we're in this kind of phase where we're able to collaborate at the application level.
Okay, and that's with the One Mind organization?
Yeah, so I have in the last, it's about 100 days now. So starting in September, except I founded, as Haruka referenced, I founded and directed the Center in Global Mental Health. That was a WHO collaborating center for just a little over a decade. And in September, stepped down, and we had a celebration of the first decade and have a new director who has stepped up to lead that center. And I have accepted a position at One Mind at Work. One Mind, the overall organization, and has a program around One Mind at Work that and I've accepted the position as president and CEO there. So we continue. I have retained my Columbia appointment. Senior faculty can make an arrangement where if you leave to serve a nonprofit or government service, retain your faculty appointment. And so we continue to work with our Columbia team and the mental health and work design lab around some of the research, but I'm running this nonprofit now, and Haruka is helping to specifically, as she highlighted, to think about the opportunities for the Japan expats in the US, and also what does it mean to return to Japan, and how do we support the mental health of these workplaces that, and again, this is another place where cultural understanding is so important. There's a question in the Q&A about stigma and in Asia and around mental health, and that's certainly the case in terms of clinical service, and it's the case in workplaces around what the cultural norms are in talking about mental health, in expressing mental health needs within the workplace, and it's a very dynamic phenomenon. It's the norms in Japan in the course of the last decade have changed dramatically. They'll be very different 10 years from now, but different cultures and communities are in different places in terms of comfort and assumptions and prejudices about what it means to have a mental health condition or mental health needs in the workplace.
Great, thank you. So I wanted to also, I'm sure we'll get back to that, but just I wanted to touch on, Dr. Pike, you've done a lot of research on comparative mental health issues in Japan versus the US. And so I'd be interested to know, what are some of the key aspects that make mental health needs in Japan specific versus the US?
So, one of the ways that I talk about culture and mental health is, for all of us in the ASIJ community, we've been to many different countries and have experienced many different cultures. And if you close your eyes and think about going to dinner in France, or you go to dinner in someplace in Africa, you go someplace in Southeast Asia, and you sit down, and the service brings over at some point in the meal something that might be small, it might be large, it might be cut, it might be in a basket, it might have seeds, it might not, it might be served with olive oil, or it might be served with butter. Like, what do you think that might be? What do you think that is, Deanna or Haruka?
You mean what is the actual dish, or what's
the item, that gets served at the table that might come in a basket, that might be small?
Bread, right.
It's bread, right? we all recognize that it's bread. It doesn't matter that it's got nuts or doesn't have nuts, has seeds or doesn't have seeds, is served with olive oil or butter. Like, we call it bread, right? So it's the same thing when you look cross-culturally at mental health conditions. You need to know the fundamentals of what is depression, what is a mood disorder, what are the fundamentals of what is an anxiety disorder. So the way I think about the issues of cross-cultural, multicultural mental health is that it's really, really important to be very well trained in the core phenomenology of these disorders, and then to understand that the expression of these disorders is going to happen in a context, and that context is culture. Mm-hmm. And so in the same way that different cultures have different kinds of bread, right? You need to understand that there are going to be different expressions of mood disorder, and there are going to be different expressions of anxiety disorders. And the differences in culture aren't just in the expression of the disorders, but I would argue actually even more significantly, what's really important about culture is understanding the meaning of these disorders and how cultures think about these disorders and how the cultures treat people with these disorders, and then what the systems are that are available. So the issues of culture, it's not just about risk, it's not just about expression, but it's really about, okay, if somebody has a mood disorder, what does this culture think about people who have mood disorders? How do they treat people with mood disorders, and what are the systems and services available? And that's all part of a story of culture. So when we think about taking an understanding of what a disorder is, those are that lens of culture is important at many levels, and we should come back around to it, starting with the core foundation that people should understand, whether they're trained in Japan or in the US or in some other part of the world, about the core science, the core biology, the core psychology of these disorders.
Oh, wow. Thank you. That was a really helpful explanation. I didn't know where we were going with bread, but it was a helpful analogy. Thank you.
Right.
Is there, I mean, just because it's so interesting, can you give us an example of one of those, like if it's an eating disorder or whatever in Japan, how would the different expressions be different maybe, or the meaning, how people are perceived or the treatments?
So, in Japan, for example, around just to take a different disorder, around mood disorder.
Okay.
The US culture tends to hyper psychologize things. So people will make a lot of attributions around why they feel a certain way, and it's highly psychological. In Japan, there's a much greater tendency to start with somatic experiences that I've got, and express oneself that with much less of a focus on psychological phenomenon, but more on the somatic experience of feeling very tired, of not sleeping, of having stomach troubles.
So the US might be more about the reasons why. What are the causes? And they're psychoanalyzing themselves. And then in Japan, they're thinking about what symptoms they're experiencing.
And they're much more likely to be around somatic symptoms. Saying that, I want to be really careful, because we can overgeneralize by culture, and there are plenty of people in Japan who are likely to talk from a very psychologically minded position, and there are plenty of people in the US who are going to complain about feeling stomach troubles, digestive difficulties, sleep problems as what troubles them most about what they would call their mood disorder. So I want to be careful, but as in terms of overlap, there's a lot of overlap, but culturally there's a bit of a distribution that's going to separate in that way.
And what about perception?
Haruka, do you agree?
Yeah, I think the many things I've learned so far from you, the one big thing that I learned is not to take culture to this big thing that explains everything. So what I mean by that is, I think when I came to this field in the beginning, I thought I want to become a psychologist for Japanese people, period. But then I started realizing the intersectionality that plays a huge role in the individual's journey. And so what I mean by that is, even that person is Japanese, just like what we were talking about, that person maybe went to, ASIJ or international school in Japan, so not necessarily grow up in that, what we capture as the Japanese culture, but more like the expats community within the Japanese culture. Maybe some people are, Japanese American sansei or yonsei who have had experience of intergenerational trauma from, the World War II incarceration history. So for me to realize that when I say I want to serve for Japanese American, the spectrum was bigger than I expected. And so understanding culture is so important, of course, but then I have to be very careful to check in with myself if my cultural assumption is playing some type of role when I'm assessing other people. So, going back to the initial example I gave about this oji-chan, if I were assessing this person without my awareness that I have now, maybe I thought, oh, don't worry, he's not suicidal. But that's me making the assumption based on my cultural, aspect. That person Japanese, I'm also Japanese, therefore this person must be exactly like my grandpa. When, if I check to make sure that my assumption is not actually transferring to that person's journey, I have to say that sounds very cultural thing. However, let me assess for the risk. And so that one step further is something that I wasn't aware of until I met Dr. Pike and talked about, what culture really means. And I think when I was hearing Dr. Pike's insight, it really made me think about how important individualized care is, because that's what a lot of the clinicians are trying to do these days, of tailoring care for that individual's specific needs. And that comes with the emphasis on intersectionality, because nowadays we talk a lot about different identities that play a role in every aspect in our life. So it's not just the, Japanese, categorizing them into these categorical, groups, but rather than look at that person, really look at that person as a, individual, and then tailor that care to that person. So, that's something I was thinking about as Dr. Pike was explaining, and reminding me of the lesson that I learned in my early encounter with her.
Well, thank you. That's really helpful, both of your perspectives. Circling back to Haruka, you were talking about this before, expats or Japanese expats in companies in the US that then might have to transition back to Japan. What kind of mental health needs have you experienced or observed as being specific to those communities?
Me or Haruka?
Haruka, I'm sorry, Haruka.
Yeah.
Or both, whoever.
Yeah, I'd love to hear from Dr. Pike's perspective as well. But I think for me, I haven't worked as a clinician for the expats community yet, because I'm not licensed, and I'm still a student. But by interning for Japanese psychologists and psychiatrists here in New York, and also, these people have license in other states like Texas and California, I was able to see the whole landscape of Japanese expats who come to New York City, but also, Scarsdale, New York, and also Houston, Texas, and also Torrance in California. And what I'm kind of seeing as a trend is that a couple years ago, or maybe 5-10 years ago, a lot of the people who came to the clinic were Japanese expats' wives.
Wow.
And that demographic really shifted to Japanese expats. And I think statistically, there's still the, when you say Japanese expats, we imagine to be a guy with a wife and kids. And from my observation through the clinics, that's still the case, but of course that is changing. But in that, the nuclear family style, before it was the wife who came for help, but now it's the expat themselves coming into the clinic. And it's very interesting to see how when they come to the clinic, they're at the crisis level. They're at the a peak of their, struggle. And they're often referred by their HR or their, I guess in the Japanese vocabulary, it's the, the subordinates and not the supervisors. So supervisors will tell the subordinates like, hey, I think you need to go to the mental health, professionals care. So they're kind of in the most heightened stressed moment. It's not, they're kind of experiencing these symptoms, early symptoms. I need help. It's more like, I really need help because I started not being able to understand the Japanese in my documents and I can't read it.
Wow.
Or I can't sleep at all because of X, Y, and Z. And there's so many factors that contribute to the shift in demographics, shift in maybe the cases that are out there. But something that I observed from my personal experience having an expat, father, is that I see a lot of expat people bring this toxic Japanese work culture abroad. And so they don't really leave that behind in Japan, but they rather bring it with them. And so that is, I view it very not work-life balance friendly, because when they bring it and then they're merging into the, American work style, they still have to also tailor what they do and behaviors to the Japanese work style, but at the same time also tailor to the American work styles. And so there's a lot of stress internally, but also their responsibilities are usually more than what they have had in their, headquarters in Japan, of they have to be the liaison between the Japanese headquarters and the local hires here. They have to train the local hires, but the retention rate usually are higher in Japan. So they leave after 3 years and they feel, then what was the point of me, training these people when they leave? Or, they have to have all these meetings that are at very odd hours. They have to still have the communication. And there's so many facts that are so interesting. But for me, it's so, I can see it in a daily life because of my father and because of my expat children community who shared a very similar feeling of how we are observing our parents work this way even outside of Japan, and it's definitely affecting how we also view work and life. And so we kind of see this as a intergenerational stress or intergenerational, I wouldn't say trauma, but it's passing along. It doesn't stop at the expats level, but to their children. And so for me, that's kind of the shift that I'm seeing in terms of people are more, likely to come to the clinic, but that doesn't mean there's less stigma. That doesn't mean that they're more, open to having a mental health, care. Maybe that is one of the factors, but I just see so many expats, individuals who are just so at the just a last resort of this desperately need help. And that's why I think the work that Dr. Pike is doing of workplace mental health is so important, because there's so many things we can do at the individual level, but there's so many things that companies and corporations can do for their employees and their families. And so that's something that I'd love to continue exploring with, Dr. Pike.
Thank you. Dr. Pike, what would you add to that? And I guess, what you're learning also in terms of how the workplace impacts Japanese abroad can be applied to the Japanese workplace in Japan.
Yeah.
As well, in terms of trying to affect that.
So one big picture comment to make about the global workforce is that when a family is an expat family, first of all, we know that about 1 in 4 people will have a mental health need that would benefit from and where it's appropriate to pursue in clinical care. That means that every family has someone, right? If it's not a parent, it's a sibling, a child. So every family is touched by needing to address and is tasked with addressing mental health needs at some point. Some families don't respond, but the ask is there, right? And the opportunity and need is there virtually for all families. The access to care for expats is complicated, right? People are not, by definition, in their home cultures. And so it's not unusual for expats to think that they're going to wait till they go home, so to speak, to get the care that they need and that's familiar. People do it with their dental care. People do it with getting their eyeglasses when they go home on summer vacation. They do it with doing a school evaluation. They do it with mental health. It's not different from other aspects of healthcare. But sometimes it can't wait. And when the mental health services aren't available, the cost to a company to have to send someone home because of not being able to access mental health services is very significant. And it's one of the leading causes of an expat assignment ending prematurely. And so this is a very real phenomenon, and it happens in both directions. I want to make a shout out about TEL and the services that TEL has in terms of serving the international community. When I was in Japan, I served as a vice chair of the board for TEL. TEL has grown its services and capacities in a wide range of ways. And to some extent, TEL is its capacities depend on who is there at various points in time in terms of language capacity or a specialization, but it is I think TEL is an organization that's a trusted, reliable center for any expat to consider if they're in Japan as an expat. For the Japanese expats in the US, similarly, it's really important to think about and find resources for that where there's this cultural competence that we've been talking about. But resources for mental health are limited virtually everywhere, and even more so for expats, given the issues about being far from home. And the issue, so the point that Haruka made is really important. Unfortunately, what that often translates to is toughing it out until it's a lot more severe than ideal, like waiting it out, hoping it's going to go away, hoping that we can just make it until the return home. And the goal in terms of building capacity and building clinical services is to actually provide more opportunities so that people will take advantage of, avail themselves of the services sooner, because the sooner you get help, the less, the better the prognosis, and usually the less severe the needs are. The one last thing that I would say, Miranda's getting on, so I think she's got some additional comments and questions for us, but the one last thing that I would say about this is that the other point that Haruka made that I want to underscore is that the approach in terms of workplace mental health is to think about how do we provide appropriate, culturally informed care to an individual at a moment in time when they need it, where they need it, how they need it. But the bigger opportunity and the bigger picture for us is going upstream. And we talk about the 3 Ps in the workplace. How do workplaces protect their employees' mental health? What are they doing in terms of systems and structures and policies and practices, education and reducing ignorance and stigma around mental illness? And then what are organizations doing in terms of promoting mental health? Also from a structural systems level, and promoting skills and capacities and knowledge for the individuals. And then when you build that culture, you have much more appropriate use of the provision of care. So that's the work that we're doing. And I have to say, although I know people are in the chat talking about some of the big hurdles, there are real hurdles, but I've been all over the world talking about mental health, and you have allies. In the world, there are people who care about mental health, who have experience, and the critical piece is finding them, because it starts as a murmur. But, you know, if you find them and have a conversation, and then you find a few more people, and now you've got a resource group, and now you have a conversation that grows, it really does change bit by bit.
Yeah, and nothing's more important than your mental health. My mother actually, another shout out for TEL is, we lived here in the 80s, and my mother discovered her interest in psychology by becoming a TEL counselor. And she was a nurse already in the US. So when we returned to the US, she became a psychiatric nurse, and then was a psychiatric nurse for 35 years. And that really started with TEL.
That's fantastic.
She always says nothing's more important than your mental health. If you don't have your mental health, yeah.
Right. That's
I'm
true.
sorry, Miranda, I think you're waiting to give us some.
Sorry, this is all amazing, and I don't want to cut in, but I did want to acknowledge that we have 4 alums who are asking questions in the Q&A. So Deanna, did you want to have a look at those?
Let me see. Hold on.
I believe you should be.
Okay, I haven't reviewed them myself, Miranda. If you've reviewed them and you can see a good question, please go ahead and just state it.
Sure. Well, Buddy Marini asked a very probably easy question for us to start with. He says it's a novice question, which I'm sure that many people have it on their mind as well. But mental health is so advanced in the US compared to Japan, which seems behind. For example, there's few psychiatrists in Japan compared to the US. Is this changing? And if so, how is it changing? What are or will be the catalysts for this change?
So in Japan, the historically, psychiatry was very medically driven, and psychopharmacology was essentially the only intervention, and psychiatric units were medication and rest. And so it's changing dramatically, but the field of psychology and the professional credentials around psychotherapy are still relatively new, and so capacity is still absolutely limited. Some psychiatrists are getting more training in mental health, in psychotherapies, but growing capacity is limited. Or the capacity is limited, but it's growing. How do we change these things? I think one of the policies, big national policies, matter a lot. So when, depending on how Japan moves forward with recognizing psychotherapists and psychologists within the healthcare system, which I actually am not quite sure where Japan is at this point, but when I was there, psychotherapy was not a regulated service in the way that psychopharmacology was. And you could practice, pretty much anyone could practice as a psychotherapist compared to practicing as a psychiatrist. That's changing, but I'm not sure exactly where it is. But those kinds of changes will make a big difference. And I think the other thing that makes a big difference in services is when people demand them. And so the Japanese people are actually presenting in the healthcare system with dramatically increased requests for mental health services and psychotherapy. And so it takes time, but it is changing. And the last thing that I would say is, although this on the services front, Japan is behind in terms of capacity, although everywhere there are capacity issues. One of the things that Japan has that is a huge asset is the respect and investment and core value around community and around connection, and using community and connection to support people, and people being able in the workplace. For example, Japan has this whole work stress syndrome, and people can say the workplace is creating, it has so much stress that I am not well and I need to take leave. And that's pretty significant in terms of structural recognition. The next step, of course, would be to work on the structural issues so that work isn't so stressful. But and what the norms are there that are perpetuating that. There's always more work to do.
Man, did you want to ask another?
There's another question that Lisa Lorraine has asked about screening and immigrants, and I serve on the board of the International Rescue Committee, the IRC, and we talk about these issues a lot. There's significant risk and limitations around developmental screens for kids who are immigrant kids or are refugees, because of language and because of other resource constrained issues. So yes, it's a big issue in terms of identifying developmental risks appropriately. The other huge risk is that there are immigrant communities that are very concerned about any exposure of their having needs within the community, not wanting to be a burden in the community where they don't feel they're from the community. Maybe their legal status is in flux and they don't want to jeopardize their capacity to stay where they are. And so there are a number of different levels of complexity there. And when you've got kids who are where there's a question around developmental disabilities or mental health concerns, it's really important to bring parents in to help ascertain and again, weave the cultural factors in to determine how to interpret what you're seeing and what's at play here, because there are many, many factors at play when you're trying to evaluate kids, including limited number of appropriate multilingual screens.
There's a question from Motoko about to talk about a little bit eating disorders in Japan and the wide, is there even wider acceptance of the fact that eating disorders exist? That's difficult to get treatment.
Happy to share with people research that we've done. We've done a lot of research on risk factors and prevalence of eating disorders in Japan. And in fact, eating disorders are prevalent in Japan, and they run the gamut, and treatment is increasingly available. Again, TEL and therapists who have trained at TEL and now have set up an eating disorders program have established evidence and built culturally informed evidence based on evidence-based treatments. So the services are limited, and like many places in the world, these more specialty services tend to be in the cities. So Tokyo has more options than in the rural communities, but there are eating disorder specialists in Japan. And again, if anyone has need, TEL has that information, that capacity. Haruka was our lead author for the recent review, the global perspective, and we reviewed the current literature on Japan. I don't know if you want to add anything to that, Haruka.
Yeah, I think thank you so much again for letting me the lead author on my first, publication. It's really such an honor. But I was able to really explore different regions in WHO recognized region across the world. And something that I found really interesting is that eating disorder didn't just exist starting from 1900s or pretty recent. It was actually mentioned way before then, what we can even imagine. But how we pathologize is very different depending on the culture, how we view the symptoms. And even if we were talking about evaluation earlier, but the main psychometric, the evaluation system we use in America is DSM-5, and there's an international version of ICD-10, which Dr. Pike and her colleagues works on to make sure that they are culturally relevant to many people. Is that some of the eating disorder categories or other mental illness categories say you need to have this symptom for 5 days a week, and sometimes those symptoms do not align with what people from certain groups show. Or like one thing that I found it really fascinating is individual from a certain area, they have this like they try to self-indulge vomiting because of the diet they get from a certain place that's not healthy for them to keep in for a long time. But if you don't know the cultural context of that, then that could be categorized into, oh, this person is trying to starve themselves or trying to not take the calories. So I think through that paper process I was able to do with Dr. Pike, and I really learned the importance of, again, like knowing that background information and then really trying to bring that into evaluation system. But one thing that I wanted to highlight about, evaluating and giving a diagnosis, sometimes that is very helpful to individuals who are looking for that, answer, the label that they're looking for. They're having all these struggles at, school, work, and if they get a certain diagnosis, they think, oh, this is why, now it makes sense. But in other situations, having that label can, intensify the internal struggle. And there's a whole theory of a labeling theory where once you get labeled, you tend to adhere to what the label might suggest. And so I'm very cognizant of when giving that diagnosis to my own clients, so being very careful how I present that to them. How do I evaluate them? How would this potentially impact their journey in our treatment? And as Dr. Pike highlighted, the systematic change really needs to happen, because as I'm exploring both careers in both the US and Japan, I'm kind of up to date on, if I were to become a psychologist here in America versus Japan, what would my career look like? And, unfortunately, both countries still do have a lot of things to do in terms of how mental health professionals work with insurance companies. For example, going back to the expats, a lot of the expats have a really great, insurance that they bring with. So they have a really good out-of-network benefits. That means if the provider is not in their network, they can still get reimbursement. But that's not true for a lot of the people in both Japan and US. And the care that we provide here in America is very, very expensive. And to provide that, $400, $500 per week for a session every week can add up. So I really do think about those systematic change of how do insurance and mental health professionals can work together to really provide that care that individual needs. Because some of the interesting observation that I make daily at Japanese psychologist, psychiatrist office, that they come in, the expats people and their family come into the office with their mental health issue and they leave with insurance issues. They spend their entire session talking about how they are not getting reimbursed. They're so stressed, all this paperwork that they didn't have to deal with back in Japan, which I resonate so much as well. And I just think that, systematic issues are really much interfering with the care that we're trying to do. So again, there's so much think that as an aspiring clinician, I'm trying to be very cognizant about, if I were to work in Japan, what does the policy and in terms of insurance or licensure look like? What my care look like in terms of what I can do versus what I cannot do because of the insurance, because of the policy. So I'm very much cognizant of those macro lens things for my day-to-day treatment.
Yeah, you can't talk about healthcare in the US without all of that complexity and the cost issue as well. Yeah, it's a huge part of healthcare. Definitely, that does come in the way of mental health, I think, in seeking help, because you feel like, well, I don't know how much it will cost, and I'll have, it's a big issue, certainly for everyone. Thank you so much. So I think in the remaining time, maybe I was hoping that you guys could give us a little advice for either current ASIJ high school students or recent grads in terms of maybe starting with you, Haruka. You've been able to do so much at such a young age. You've done really interesting internships. You just authored your paper. What advice would you give to other young people in terms of, how you've been able to make that happen? And for students who, have a specific interest, it could be mental health, but it could be something else. I know you were just featured in this issue of the Ambassador, and you had some great advice for what it takes to kind of be able to make your path.
Yeah, I think it's really interesting, because when I think about myself in terms of the ASIJ timeline, I felt like I just went there like last year, but it's been almost 10 years since I've been there for the first time. So I feel like I'm not really positioned to give any advice or anything, but I can share what has worked for me. I think first of all, I just got really lucky with all the opportunities and mentors that just came along with that. And so what I mean by that is whenever I reach out for communication or networking, I don't think over the last 3 years of reaching out to a bunch of people within the ASIJ community or outside, no one has ever said, no, I don't have time for you. They said, yes, let's meet up, and let's meet on Zoom, let's meet in New York City, let's meet in London. And so I got really lucky with amazing people who are willing to take the time to nurture and invest the next generation. So I just want to say that I think I got really lucky with that. But what I did during my junior year in college is that I networked a lot. And what I mean by that is I was being really proactive in reaching out to the people that I found, again, through ASIJ's alumni portal that Miranda shared with me. I could look up what people are doing, what my senpais are out there, and then let me reach out, or my personal network. And I really did reach out with quick email asking for the time to meet. And at first it was very nerve-wracking because I think my, inner Japaneseness is still here of, who would ever want to take time to talk to this random Japanese girl student here in America? And so I was, very hesitant to reach out. I felt like I was being a burden. I felt like I was taking their time. But then as I was able to network people, and again, I got really lucky with these people really empowering me, saying, I learned from you. I love seeing you grow. I see myself in you when I was younger. And all these words were so simple, yet made me feel like, oh, maybe I matter. Maybe I can even bring some type of value to my senpais. So now I started kind of seeing all these networking or meetups opportunity as a way of like a reciprocal conversation rather than me, taking their time and wisdom, but rather I also leave a piece of my story that is maybe unique to me. And so that being said, I think networking from early on has helped me a lot. And I think having this label of a student, a label as a ASIJ alum really have helped. And Dr. Pike is an example. I was pushing my ASIJ connection when I first met her. But I think when, I say I'm a student, people were more excited to help you because you're still in this emerging field rather than when I'm maybe in a later in career where opportunities are a little bit limited than where we are as a student. So I really did take that advantage to start my networking really early. And because I did that in my junior year and a little bit in senior year, latter part of my senior and my master's, now I am leveraging the connection that I already made so far and say, hey, I'm doing this one. Can you help me out? Rather than, hey, my name's Haruka, nice to meet you, and starting there. So really encourage people to take the advantage of ASIJ community, first of all, and the powerful, Japanese and Japanese American and people who have worked in Japan and US platforms to just reach out. And, the worst case scenario is you don't hear back, and that's okay. And you can always connect with them on LinkedIn. So that's kind of my advice or something that has worked for me.
And were you asking for like exploratory conversations at the time mostly?
Yeah, so I think because I was never really seeking for job opportunities or intern opportunities because I was still in school, a lot of the time I would have about like a 6 or 7 self pitch about who I am, what I'm doing here, and what I want to do. And I would ask for a guidance or career guidance. And, oftentimes without asking, people will say, oh, I know this person, let me connect you. Oh, I know this field, let me help you like this. And again, because I've never been on that other side, I don't know what's the key to them offering instead of for students or young people to ask for something. But for me, again, I got really lucky with people offering instead of me asking for something. But I did ask for their time. And again, it was I got really lucky with very kind mentors.
Yeah, I think your advice, start early, is a good one. Don't wait till you're about to graduate. And also to be more exploratory, people don't feel pressure to like deliver something beyond just their experience. Probably takes the pressure off. But yeah, I'm sure you got more than lucky. It's also your natural charisma and great profile.
And I would say also,
Sure.
could I also just add,
Yeah, please.
I think that Haruka, as you say, is being modest, that Haruka was very focused, and it's not just luck, or luck is right. Luck favors those who are prepared. But it is also, I'll say two things. If I remember correctly, Haruka, Suzanne emailed me and I didn't reply the first time. I meant to. I read it and I thought, oh, sure, I'll do that. But then I sort of lost track of it. And Suzanne pinged me again, I don't know, a week or two later, and said, just want to follow up here. So one thing I would say is, if there is someone that you want to talk to for ASIJ students and young alums, don't hesitate to follow up, because if a month later I intended to follow up, I intended to respond, but I didn't, and I haven't heard from this student a month or 2 months later, I figure, well, it couldn't have been that important. So I'm not going to follow up at that point. So if it's important to you, don't hesitate to just send a quick note to say, hey, just want to bring this to the top of your inbox. And I think the other thing that I can say from my perspective about being ready and making the time to meet with Haruka is that Haruka was very clear in her email. To your point, she had a few questions she wanted to ask me about these things. It's very helpful to someone, when I'm getting emails from young people or young professionals or students, to have a sense of what do they want and how can I be helpful? Tell me what you want from me so I can be helpful to you. And then it's clear when I can say, sure, I'm happy to meet with you, or, you know what, given your interest, let me connect you with this person. So spending that time in the inquiry is really helpful.
That's terrific advice. Thank you. Miranda, did you have any announcements you wanted to make?
Yes. First, I wanted to just say thank you so much to Haruka and Kathy for your invaluable insights. This has been really fascinating to hear. And I think that we had a lot of people who were still really interested to hear more. So it's just been wonderful to have you. Deanna, thank you so much for moderating. As I always say, you're so great at keeping the conversation flowing, and I really appreciate it. For those of you who were interested in having your contact information shared out, we will put that together and share it out within the next week or so. If you indicated that you were interested in that in the sign up through Zoom, if you've changed your mind, just go ahead and reach out. We're always happy to make that change for you. We will include Haruka and Dr. Pike in that as well, so you can direct any questions you might have to them. From our side, if you want to stay connected with fellow ASIJ alums or with ASIJ, we would love to have you attend. In Tokyo, we're having a Bonnenkai tomorrow, actually. RSVPs have closed, but if your plans have changed and you would really love to come, you should reach out to Deanna.
Yes, we still have some capacity, and we had a great time last year. Please come. It's a great event. And as we heard today from both of our wonderful panelists, you're part of something magical. So take advantage of it. Come hang out with us.
We'll also be having Shinnenkai in the new year, either January 5th or 6th in Honolulu. Stay posted, and if you're interested, reach out and I can connect you. In New York on January 27th and in LA on January 28th. So there'll be information. There's been information and there'll be more information coming out about those. But if you're interested in attending, please do just shoot me an email and I'm happy to get you on the list. We always love to hold events around the world. So if you're interested in holding one, reach out. And thank you so much for attending today. So I think that's it from us. Thank you all for your time.
Thank you.
Thank you.
Thank you.
Thank you so much.
Thank you so much.
Bye. Happy holidays.